As concerns about a new wave of coronavirus infections continue to rise, some are calling for overhauling the nation's healthcare system to enhance its ability to respond to pandemics. Experts point out that the nation needs an entity to oversee the treatment of critical patients and that public healthcare should be improved as well.
So far, the COVID-19 mortality rate in South Korea has been known to be 2.3%, relatively low compared to other countries. This means 23 out of 1,000 patients in the nation died from the virus. KBS obtained a report on ways to overhaul the country's healthcare system. The reality described in it is quite different. Korea is less vulnerable to the pandemic compared to European countries with large senior populations because its aging process is still in the early stage. If Korea's age structure is adjusted, its mortality rate from COVID-19 rises from 2.3% to 2.8%. In other words, the mortality rate is higher than that of Portugal, Germany, and Sweden.
노인층에서 사망률이 높다는 점을 고려하면 국제 비교를 위해서는 반드시 연령 구조를 보정해야 되고 우리나라가 유럽 국가들에 비해서 그렇게 낮은 수준이 아니라는 겁니다.
Medical experts point out Korea failed to lower its mortality rate further due to the lack of a system that can sort patients and share medical resources effectively during the outbreak.
중환자실 갈 사람, 생활치료센터에 갈 사람들을 분류하는 작업, 그다음에 핵심적인 그 기구 시설들을 우리가 미리 확보해 놓는 것, 이런 게 필요했죠.
On February 26th, when hundreds of cases were detected in Daegu, authorities had trouble finding available hospital beds for COVID-19 patients among some 10,000 beds at ICUs nationwide. One of the most urgent tasks now is setting up an entity in charge of overseeing critically ill patients with infectious diseases.
진짜 중환자를 볼 수 있는 병상이 몇 개가 있는지 파악을 해야 되는 겁니다. 그래서 이게 몇 개가 있고 이런 환자들이 올 때 어느 병원에 그 가용 병상이 있는지를 알아서 걸로 보내줄 수 있어야 돼요.
It's also important to increase the number of public medical centers that can act as the first line of defense during infectious disease outbreaks.
30만 명 인구 규모의 그래도 제 기능을 할 수 있는 그런 공공병원이 한 300병상 정도의 공공병원이 하나씩은 있는 게 맞다.
South Korea has successfully warded off the first wave of the pandemic, but many believe the country must overhaul its healthcare system to prepare for a second wave and save lives.